There are a number of contributing factors to why the United States has one of the highest maternal mortality rates compared to all developed countries, and why that mortality rate is increasing. One of the most glaring reasons is that there is a Black maternal mortality crisis that has really gone unchecked, with Black mothers being 3 to 4 times more likely to die of childbirth and during pregnancy than white mothers.
Stereotyped notions about who Black women are, the ways that sort of their concerns can be dismissed, the ways that their pain is not believed or mismanaged or undervalued. I think that we have a lot of room to grow as a profession in this clinical space about how we provide more woman-centered care, and also how we sort of elevate the level of partnership and basic respect that we're giving to women, and in particular to Black women.
Well, there are many complicated medical issues that can contribute to maternal mortality. We know that standardized care in the approach to obstetric emergencies can reduce maternal mortality. So responding to hemorrhage in a team-based standardized fashion, responding to severe maternal hypertension using well-established algorithms can reduce maternal death, but we don't see those practices being used equitably across the United States and across all mothers.
When we talk about the structural and systemic inequities that disadvantage people from the womb, right, over the life course from the beginning, that those cumulative stressors, those chronic conditions, then you add in racism, sexism, classism is kind of where I started. Those are the conditions that bring people to us for clinical care, kind of already starting off at a disadvantage. So I truly believe that advocacy and really looking to create more just and equitable structures and policies and laws and communities are going to be the ways that we can take a stab at a primary prevention opportunity, so that when we're hoping that we could see more equitable outcomes on the back end.
Doctors should be very involved with supporting and advocating these policy changes that will go to increase funding to community-based organizations, address those issues around maternal mental health, even address the environmental health concerns that can lead to inequities in maternal health outcomes.
The greatest thing that we've been able to gain an appreciation for is how much of this morbidity and mortality is occurring after our clinical encounter is done. So, in that postpartum period, we really underestimated how important that year following pregnancy is in the life and health of women.
Presently, under Medicaid, states are required to only cover postpartum care through 60 days postpartum. So in spite of providing healthcare through pregnancy and identifying critical medical conditions, mental health disorders, we are not able to continue that care in the time when mothers most need it. The American Rescue Plan is providing that opportunity right now for states to amend their state health plans to include Medicaid through that first year postpartum. And we certainly applaud the states that have taken action on that, like Illinois, who's passed that waiver. And we're looking hopefully forward to more states taking advantage of this until we have a national policy where all mothers can get the care they need through that first year postpartum.